House with Paul Rosen.
Our diets, our Western diets in America are just really, you just don't realize how poor they really are.
What would you say to others who would like to feel better?
Sometimes you need to find the instruction. That's where the testing and everything comes in, because without that knowledge, there's no way I could have got to the point where I'm at today.
Straight talk about health.
And then I start preaching and telling them what I've been doing. And this guy named Paul Rosen has changed my life.
With your host, Paul Rosen.
By the way, the information contained in this program is not approved by the FDA, nor intended to treat, diagnose, or claim to cure any medical condition or disease as defined by Western medicine. However, skilled practitioners of many disciplines have found nutrition response testing to be a highly reliable supportive technology for assessing the health and fitness of the body's functional system.
Let's get right to it, Paul. This thing about the thyroid pretty much relates to our health in every way we can imagine. Is that right?
That's true. Thyroid basically is connected to almost every cell in the body, which is why, because of the epidemic, truly epidemic, in the U.S. and other industrialized countries, for reasons that I'm going to share with everyone, that the symptoms that people experience, such as those that I listed when we first started, are so common.
You said epidemic, so are there a number of people or a great number of people in the country who have problems with their thyroid?
Well, just to give you an idea, some statistics reveal that levothyroxine, which is a hormone replacement product for thyroid hormone, is essentially more prolific, purchased more often than statin drugs, which is, which unfortunately is, one of the best-selling medications in the United States.
Now, that one you mentioned, what was it again? Please repeat that name.
Levothyroxine.
Levothyroxine. That's a medication to treat problems with the thyroid. Is that right? Is that an over-the-counter medication?
No, it is a prescription medication.
So a lot of people are being diagnosed as having thyroid issues. They're given this thing, which will, in theory, correct the problem.
And it never does, ever. Never does. It can't. No medication can ever completely address functional illness. Now, it may help may improve some of the symptoms, like fatigue. Chronic fatigue is one of the most often experienced symptom that people, manifest when a thyroid has gone south. And blood testing is essentially considered the gold standard for identifying whether or not a thyroid is having problems. If you've ever had a blood test and gotten readings with respect to your TSH, or thyroid stimulating hormone, then you know what I mean. The problem is that it is very clear and very well known that even if your thyroid stimulating hormone falls within what is considered the normal range, you're still experiencing the symptoms of hypo or hyperthyroid. So the question is, why is that? Why is that? And the complete answer to that question is not defined yet, but I will tell you in my clinic that most people who are experiencing these symptoms of fatigue and loss of energy and just a general lethargy or unexplained weight gain or cold extremities, feeling cold all the time, muscle or joint pain going to as extreme as fibromyalgia, irritability and depression, so there's an emotional component for some folks, hair loss, dry skin, hair falling out for no unexplained reason, sleep apnea, forgetfulness or impaired memory or reduced ability to concentrate, carpal tunnel syndrome. decreased hearing, actually affecting your hearing, irregular heart rhythms. Now, I'm listing all these things, folks, because many of you out there are experiencing one or more of these symptoms. And many of you out there have had blood tests, which, according to the powers that be, put you in the normal range. And therefore, you couldn't possibly be experiencing these symptoms because of thyroid issues. Well, the truth of the matter is that it's totally not true.
I think one of the reasons many may have misconceptions about problems with their thyroid is that these are very general symptoms. They could be indicators of other health problems in addition to the thyroid. But as you indicated a few minutes ago, Paul, if you have certain issues with parts of your body, that may trace back to the thyroid.
It absolutely may. And the thing is, when you make the general statement, which is interesting because of a lot of people, even professional people, will say, well, gee, these symptoms could be caused by many different things. The reason that's true is because the body is really only capable of manifesting a limited number of symptoms. There's only a limited realm in which the body can manifest its concern for itself, right? So, yes, it's true that these symptoms can be caused by many different things, but it's very simple to find out whether or not the thyroid is involved. That's where the nutrition response testing comes in. That's where the muscle testing comes in. That's what allows me to identify these conditions and fix them, right? Help the individual fix them with nutrition, time and time and time again. However, the person experiencing these symptoms has to be willing to change their lifestyle. You cannot continue to do what you've been doing and expect a different result. You just can't.
If somebody was diagnosed by a medical doctor, perhaps of having thyroid issues, then maybe the medication would come into play, right?
What do you mean?
Well, if a MD did his testing and found that maybe his patient was having issues with the thyroid, that's when the medication you mentioned would come into play.
That's all doctors do is provide you with medication. The problem is it doesn't fix anything.
My point with this is you can be diagnosed as having a thyroid issue, but maybe the solution isn't the right one, the one that's recommended to you.
The solution is nutrition. The solution is finding out why your thyroid isn't working in the first place. Thyroids stop working for many reasons. The greatest among them is obstruction, interference. And I'm going to be talking about some of the factors that interfere with the thyroid function. And they're very common and they're very pervasive throughout the entire culture. So what you're looking at, the question you must ask is, okay, well, your thyroid was working fine when you were 10. It's okay when you were 20. What happened at 21? What happened at 35? What happened at 42? Why all of a sudden are you experiencing some of these symptoms, which might lead back to a thyroid condition? Other symptoms, menstrual disturbances. Oh my gosh, PMS is absolutely, any woman who's experiencing PMS has a complication as part of has as part of the problem a thyroid issue. 95% of the time, guaranteed, regardless of what the blood tests show. Regardless. This is really important. Migraines, pain with menstruation, emotional imbalance up and down, irritability or depression. All of this, I all but guarantee, so within the 95% range, that thyroid is part of the issue. And then you've got some people experience a chronic hoarseness of their voice, or they lose the full throatedness of their voice. That can be thyroid as well. Heart disease, irregular heart rhythms, absolutely thyroid complication. Weakness, increase of cholesterol issues like an increase in the LDL can be related to a thyroid imbalance.
Now, before you continue, Paul, you mentioned statin drugs a while ago.
Mm-hmm.
If somebody is showing cholesterol levels that are out of whack, is that why statin drugs may be prescribed?
Statin drugs are now being prescribed like candy in this country, and my understanding is they're even prescribing it as a preventative, even if you don't have cholesterol issues. There are physicians out there who are just, as a matter of course, once you reach a certain age, they are prescribing these as preventative. It is insane. It's totally insane. These drugs are poisonous. They should be avoided at all costs. If there's an effective option, right, they should be avoided at all costs.
And to back up again a little bit, you said that thyroid problems may cause your voice to become hoarse. Is this partly because your thyroid is located right there in your throat? And
exactly.
That's also why if you have throat swelling, that may be a symptom of thyroid issues.
Mm-hmm. Mm-hmm. Goiters, which is essentially the swelling of the thyroid. You can actually, in folks who have a more advanced condition, you can actually see the swelling, around the throat. Yeah.
Goiters?
Goiters.
What's a goiter?
A goiter is an overgrown thyroid.
Okay. Watch out for those goiters.
Yeah, watch out for that. You love these little
Well, I
words.
just thought that was funny. A goiter is a funny thing. It's a funny thing to
It's not
discuss.
funny. No, it's
not
funny
if you have them. No, nothing amusing about goiters.
Nothing amusing about goiters, except the word itself.
Let's go quickly to the phones before you continue, Paul. We
Sure.
want to talk to Terry. Good morning, Terry. Thank you for calling. You're on the air with Paul Rosen.
Good morning, Terry.
Good morning. Thank you for taking my call.
You are welcome.
I had a thyroid question.
Sure.
I was diagnosed when I was like 12, and I was just wondering what you think about. I was born in the Tri-Cities 2 years before they let out the iodine in the air at Hanford.
Mm-hmm. Absolutely.
So I wanted to know what your thoughts were on that.
Well, just so you know, just for your own information, I'm not a medical doctor. I'm an acupuncturist and nutritionist, so it's important that I say these things. However, I handle thyroids on a routine basis and help people, restore function. I mean, people who are experiencing the complications of thyroid issues, everywhere from, like you say, as early as, not even in the teens to as old as 70s, 80s, and 90s, getting people off their medications. Yes, that is absolutely radiation. What happens is radioactive, iodine can displace the organic iodine that the thyroid requires in order to operate normally, and so that would be an obstruction. It would be, of course, unusual, but your situation is unusual there. Not very many people are live in the vicinity of radioactive operations.
Yeah, it's all very interesting. My whole family, except for the one brother that wasn't born there, now has they all followed me with thyroid problems.
Absolutely, and this is.
And I was told that my kids, as long as my thyroid was acting fine, that my kids wouldn't get it, and my daughter now has it, and she's 30.
So the question is it the same cause or is it something different? Now, where the two meet. It falls under the heading of obstruction. That is, something is impairing the thyroid from operating properly. It is not difficult to find out what. It just isn't. It's not difficult at all. Having said that, it's absolutely critical. And I don't know if you've ever listened to my show before, but it's absolutely critical, first and foremost, that you have to stop eating sugar. You absolutely have to cut it out of your life.
I have, because I'm a diabetic now.
Well, so then fruits and grains as well.
Fruits and I don't eat fruit.
And grains.
Yeah, I was really good with grains, not so much as I was before, but I'm still really good at keeping my weight down and my numbers good.
Yeah, but the thing is and this is no take this as compassion. Not as
absolutely.
Not as criticism, because I'm not judging. But
I'm all for being real. So
but
that's
so
great.
so let's be real. If you're a diabetic, you cannot eat grains, fruit, and sugar under any circumstances for any reason, no matter what. Whether it's your anniversary or your birthday or your mom's birthday or your dad's birthday or your kid's birthday or whatever celebration you feel like giving yourself permission to eat sugar, you are completely out of your mind. If you think
I don't eat cake or candy or pot. I don't do any of that.
Or waffles or French toast or what you can do, to have a little confection of this or that is to really try utilizing nut flours, things like almond flour and hazelnut flour and those types of things and our website, you can go and look on our website at AcuNatural, acunatural.com, and you can find lots of recipes where those ingredients are used. So so you could make something for yourself, as a treat. But the thing is it's very interesting, and I really appreciate your calling. People, we as human beings tend to think that a little bit of something that absolutely, if we were to think about it using a lot, right, is not as bad or it's okay to do. But it has consequences. And by the time you're a diabetic, type 2?
Yes.
By the time you're a diabetic, your body's ability to handle sugar, essentially, or anything that turns into sugar with respect to carbohydrates, is essentially history. Not permanently, if you do the right things. But a little bit is a lot.
Right.
A little bit is a lot. And so, I'm sure you've heard this before, everything in moderation, just do everything in moderation. Everything will be fine. And this is just a trap. This is like the this is the pitcher plant, the orchid that attracts the fly. Come over here. Tastes pretty good. No more fly. And the problem with diabetes is that you live a long time. You can live a long time with that condition, and you will experience this, horrifying sort of circling the drain with all the symptoms that you get. And if you're utilizing the medications,
I don't do medication.
Oh, that's great.
I know. I refuse.
Yeah. Well, if you cut the grains out, then you would be even farther away from that tipping point. But medications are so corrosive in so many ways. The side effects are just, they're just oh my gosh kind of list of side effects.
Well, as far as medications go, I don't know if that's part of the thyroid thing with me. Is I'm kind of a rare breed where I can't take medications for anything. They all make me sick. They all make me complete opposite of what they give it to me for.
Do you still have a thyroid?
Yes.
And it's just not functioning the way it should.
I've been on medications for it since I was 12.
Yeah.
So I've had some ups and where it is too much. Mostly I get where it's too much, not too little.
Yeah,
and then they have to fix my medication.
We'd have to prove there was no hope with respect to you. I unless there is irreversible damage to the thyroid. My experience, or having it removed from your body completely. My experience is that find the obstructions, and then start addressing them, and then amazing things can happen.
Really.
Amazing things can happen. Yep, that's my own personal experience.
Oh, nice.
So the obstructions are, like you said, the radiation. There are products that we have that we use, that can begin the process of restoring, the cells. And oh my gosh, there's so much we can do that is alternative. So the thing is it's providing the body with what it needs, does amazing things, and limiting the obstructions, the environmental impacts, and oh my, the body is amazing. It's a perpetual healing machine until it isn't, and then we call that dying.
Yeah.
So and especially your daughter. Oh my gosh! I mean, there's no reason to think that. Well, maybe a little reason, but not much.
Now she has Hashimoto's. I don't have that.
Well, Hashimoto's is in the Western milieu, Hashimoto's is an autoimmune disease, and according to Western guys, autoimmune disease is the body attacking itself for no reason, which is nonsense. It's
she
total.
has several autoimmune, actually.
Yeah, it's total. It's total nonsense. It's totally addressable. Absolutely, totally addressable.
That's good to know.
But you have to be willing to change your lifestyle. You just have to.
Oh yeah, absolutely.
And so, for your daughter, I know she's willing to change, but for you as well. Plus, the worst that can happen with your own personalized nutritional healing program is that you actually get better in so many ways. So many ways.
That'd be nice, because I feel bad in lots of ways right now.
So many ways. Oh my gosh.
And that's even with me doing pretty darn good to stay off medicine for almost 7 years.
That is
with diabetes.
And because of that, hon, oh my, to me, your body is still really raring to go, ready to actually take the next step. But you have to know what your personal nutritional deficiencies are, not just some general picture.
Yeah,
you have
I did go to a functional medicine place, and I found out some things, but I don't think I got all the answers that I actually need.
Well, you can't, because if you're using Western medical approaches, you're not finding out what the innate intelligence of your body has to say. And you have to use very sort of unusual methods to get that done.
Okay.
Just go to the website and take a look and see, AcuNatural, acunatural.com. Take a look at it, see if it still interests you. But the bottom line is I personally have helped, oh my God, I can't even count the number of people who have, been just catapulted into a completely different experience when they take control utilizing their own personal nutritional healing program. It's amazing to me. It's why I keep doing what I'm doing. And I've been doing this a long time, 25 years. So,
nice.
So, I mean, medications are suppressive by nature. Do you understand what I'm saying when I say that?
Yeah. Yes, absolutely. Because I barely even take a Tylenol or anything.
Yeah,
I try not to take any medication.
They're suppressive. They're suppressive by nature, which means that they will not, never not be able to treat the root cause of the functional issues. And I'm speaking primarily here to functional issues, not broken legs. Not acute life-threatening, conditions. I'm talking about having to live with this thing day in and day out, week in and week out, 365. Those are functional illnesses, and those things, is just a body gone awry, not capable of managing itself because of the environmental obstructions preventing your body from, from functioning normally.
Yeah.
So come and join us.
I will. That sounds great. Thank you.
You are welcome.
We had a guy call in a few minutes ago, Paul, a gentleman, who wanted you to speak more about why diabetics should not eat fruit. Why is that?
Well, it's slightly complicated, but I'm going to simplify it because I know I understand things if they're simplified for me. So the bottom line is, if you're a diabetic, all of the necessary organs and glands that are supposed to be regulating your blood sugars are compromised. They're compromised. And they're compromised for different types of reasons, but totally identifiable. And in my experience, almost always fixable. That is to say, I've worked with people who had, up to diabetics who have had up to 11 and 12 medications and gotten them off every single one. Every one. And they are now living happily, not eating grains and fruit and sugar, and are taking no medications at all and have never felt better in their lives. So what's happening with respect to diabetes is not just that your pancreas isn't working properly, and we'd have to find out what's going on there, because pancreases generally just don't stop working. There's some obstruction, there's some interference, some impairment that blood tests, saliva tests, hair tests, skin tests, stool tests cannot identify, just like the topic we're talking today, thyroid issues. Simply cannot sufficiently identify the underlying root cause, even if your blood test reveals that your thyroid is abnormal, let alone normal, and you're still experiencing symptoms.
So specifically, diabetics should not be eating fruit because fruit has glucose. Is that right? They're full of sugar?
Fruit has fructose.
Fructose.
Not glucose.
Okay.
And fructose is just another sugar in a concentrated form. And so so backing up a second, every food is turned to sugar in the body, glucose, every food, ultimately, because that is the fuel that your cells essentially utilize to keep themselves alive and going. But when you're eating something like broccoli, which might have some sugar in it, there's very little sugar, and there's also much more material in the broccoli itself to impair the impact of the sugar on your liver and on your pancreas and on your thyroid, etc. Whereas fruit is just pure sugar. It's just pure fructose. Same thing with sugar itself. The same thing with honey. The same thing with maple syrup. The same thing with all concentrated sweeteners. As a diabetic, your organs and glands, your whole system with respect to handling sugar is completely overwhelmed and not functioning. Now, if you want to remain tied to medications for the rest of your life, then don't listen to a word I say. Just keep doing what you're doing. But if you would prefer to not have to take medications and to not experience the absolute confirmed side effects from those medications, then the first step you must take, the most inexpensive step that you must take, is no grains, no fruit, and no sugar.
There you go. 503-225-0860. Paul's right here ready to talk about your health issue. 503-225-0860.
I make that statement because I have, as I said, turned around many a diabetic in my office and gotten off many a diabetic off of all of their medications. And I have never been successful. I am 0%, batting zero, for a person who wanted to continue to eat fruit. Zero, batting zero. But batting 950 when they choose to follow the direction, stop eating grains and fruit and sugar.
Well, I think for many of us, that is a tall order. If we want to be healthy, sure, we'll do what we have to. But I'm a guy who likes fruit quite a bit.
Well, who doesn't?
I enjoy fruit salads and all that kind of stuff.
Who doesn't? You're not a diabetic. Doesn't matter for you. But for a person who's, let's put it this way. For a person who can't swim, jumping into the water is probably a bad idea. For a person who can swim, no biggie. No big deal. So that's essentially where a diabetic is. They're already, over their head with respect to their body is simply incapable of functioning normally. And you know that because you're a diabetic. So, like it or not, if you want to live a higher quality of life for a longer period of time, as a diabetic, no grains, no fruit, no sugar, no question. That's it. End of story.
One more note, you can get a free chapter of Paul Rosen's book, The Missing Piece. Just go to his website, acunatural.com, acunatural.com, and fill out the dialog box that pops up. Rest assured, no information you provide will ever be shared with anyone else. So, what are you waiting for? Get going on your personal road to wellness today.